Advocacy and health policy are a passion of mine, but for those of you who think that advocacy is not your thing, realize that we advocate for our patients every day when we fight for insurance coverage and access to care, when we serve on task forces and regulatory bodies, when we work on grassroots initiatives or raise funds, do groundbreaking research, educate the public, or even run for office. This article describes 4 historical examples of plastic surgeons who led change at the national level. The first example was the U.S. Flammable Fabrics Act in 1953, which was led by Dr. Kreikeler after treating a lot of children with burns from flammable fabrics. The second example was when ASPRS, led by Dr. Gorney, fought the FTC's accusation that board certification of plastic surgeons was self-serving, exclusive, and a restraint of trade. The third example that they looked at was the Women's Health and Cancer Rights Act of 1998. This was spearheaded by Dr. Wider and inspired by his need to fight for breast reconstruction coverage for his patients. And finally, the fourth was the Breast Cancer Patient Education Act of 2015, which was spearheaded by ASPS after finding that despite the law, many women were unaware of their breast cancer reconstructive options and that it was covered by insurance. These have all had long-lasting and far-reaching impacts, and it was really interesting to read in the article about the background and the stories that led to each of them. The authors also talk about different ways that plastic surgeons can advocate for patients, including being involved in organizations such as ASPS and, of course, Organized Medicine, PlastiPack, meeting legislators, and amplifying messages via social media. The article highlights that plastic surgeons can lead key advocacy initiatives and can really make a difference. So hopefully, after reading this article, you'll be inspired to spark your own advocacy efforts for something that you're passionate about.